We believe that healthcare is a human right, and we believe that everyone deserves access to comprehensive, affordable, and guaranteed healthcare.
Imagine a world where everyone receives guaranteed health care, where health care is a human right, not based on ability to pay, instead based on need. We have called ourselves the greatest country in the world, California, the greatest state in the country. But what does health care really look like in America?
12 years ago I was diagnosed with breast cancer, and 5 years ago the cancer spread, so I'm now a stage 4 terminal cancer. I keep working just enough so that I can maintain our health insurance. My main concern is that the health care, and how are we gonna provide that for my family? We have really no savings left.
When you have to make the decision of, well, okay, do we pay the electric bill or do I get my medicine? It was easier to say, well, okay, maybe I'll end up paralyzed, but I can't take my MS med. I have good insurance, I can't say I don't. If I have to make that decision, I can imagine somebody who can't.
And in California?
And more patients are dying that shouldn't be in those hospital beds because they don't have access to basic medically necessary health care.
I heard it on TV. It's a health clinic that's free. I've been here since 10 in the evening, and I'm waiting to get a ticket to go in to get checked. I'm really concerned. I see children here. I see older people here that shouldn't be here in the cold, you know. It's really cold right now. I see people that haven't even been to the doctor in over 10 to 15 years. I haven't been to the doctors in over 4 years because I do not have health insurance. I'm self-employed. My business is very slow, and I cannot afford $1,500 a month in insurance. I am a cancer survivor, and I've had cancer in my uterus, and I would like to check and see how everything is inside me. It's very sad, but it's true. You know, this is reality. Yeah. This is reality. I mean, I'm scared, but what can I do? You know, there's no other programs out there for you to get checked.
I'm unemployed. I lost my job a little over 2 years ago, and I cannot afford health insurance. I used to work 8 years for Blue Cross, and I worked 2 years for Health Nets. For Blue Cross, I was a senior outreach specialist. It is very ironic being out of here with no health insurance and having worked pretty much 10 years in the health insurance world, and yet I have no health insurance. Healthcare in America, big business, where if you have no money, you have no health care.
You know, the California Healthcare Foundation just last week issued a report, and it didn't come as a surprise, but it wasn't pretty either. It revealed that over the past 10 years, the cost of healthcare premiums have increased 153%.
We all know that something is wrong with healthcare. Many people thought that healthcare reform would fix the problems. But healthcare reform, also known as the Affordable Care Act, isn't really a solution to the healthcare crisis. It's estimated that 3 million people in California will still remain uninsured 9 years from now under this plan. Middle-income earners will be required to purchase private health insurance, leaving these consumers vulnerable to unrestricted, ever-escalating insurance costs. The ACA continues the current market-based system where your choice of medical providers is severely limited by insurance companies, allowing the same companies that helped create our healthcare crisis to dictate which providers we use and what medical care we receive. Compare that to a single-payer system, which frees up billions of dollars for healthcare, automatically covers everyone, allows you to choose your own medical provider, and everyone in, nobody out, guaranteed healthcare including vision and dental, even if you lose your job or fall on hard times. Single payer puts medical decisions back into the hands of nurses and doctors.
We have the most resources in the world, the richest economy in the world. There is absolutely no excuse that we can't have a top-rate healthcare system.
Now, a broad campaign of people in California have the opportunity to set a standard of care for our nation by bringing students, small business people.
I'm here to speak to you about my experience with our healthcare system as a small business owner. Our rates for health insurance have gone up every year since we opened in 2000, some years by almost 20%.
Seniors, faith-based communities, people of all backgrounds and ethnicities together to do what we know is right. That campaign is the campaign for a healthy California. California is the ideal place to prove that single-payer healthcare has a place in our society. But we need you. As with single-payer, we need everyone in, nobody out. We know what's right. We know we have the power. Become part of the campaign for a healthy California and win healthcare for everyone.
I challenge you to come up here, part of the podium next year and the year after and every year until we have single payer here in California and in America.
I don't know anything about the law, but I think everybody should have health care, like Canada. Yeah, Canada, everybody, millionaires or even they all have health care, and that's really fortunate. Maybe I'm going to move to Canada.